Higher education institutions are facing a number of challenges on both the financial side as well as the people side of their operations. From a financial perspective, the financial markets have been rather volatile over the last several years, creating undue stress on the endowments, which have traditionally funded a significant portion of operations at a lot of institutions. At the same time, financial pressures at the state level and the federal level are resulting in cutbacks in state funding and grant funding, which also tends to fund a good portion of the operations for the institution. In addition, healthcare costs have been growing at a rate much greater than revenues are for the rest of the institution, and it's straining the ability for employees, the faculty and staff, to show up to work on a given day and be fully productive and engaged in their work in carrying out the mission of the institution. Higher education institutions are going to have to take a look at healthcare reform from a compliance perspective to make sure that they're meeting the different regulations from a plan design and operations, a communications and administrations perspective. Financially, institutions are going to have certain costs that they're going to have to budget for, but there's also certain opportunities that they can take advantage of within healthcare reform. So they need to take a look and model out the impact of healthcare reform and look at how they can help reduce those costs through options available with subsidies, through accountable care organizations, and through new wellness provisions that are going to enable the institution to manage long-term healthcare costs more effectively. At the same time, healthcare reform is going to have implications for the employment value proposition at the institution. When an institution goes through the modeling, they're going to have to make decisions. Are we going to stay in the healthcare game, or are we going to get out and have our employees get their healthcare through the exchanges? This is going to have big implications for the institution and how they engage with their employees. And if they do decide to get out, how are they going to make sure they're engaging and attracting and retaining that talent? And if they stay in the healthcare game, they've got to figure out a strategy for keeping their costs low enough so that they don't have the excise tax in the 2018. Operationally, higher education institutions, particularly those that have their own academic medical centers, are going to have to rethink the way they practice medicine. This is going to have implications for whether or not they engage in an accountable care organization, as well as the way they are going to attract and retain people, the way they pay people and reward people for achieving the clinical goals that are required for accountable care organizations. Reactionary strategies no longer work. We need to be more proactive. We recognize that the world is changing. We're in a new normal, and you've got to start with what the institutional strategy is and what the leaders at the institution envision for the future of the institution, and develop an internal strategy that's geared more towards the internal stakeholders to make sure that they are aligned and driving towards the achievement of that mission, and that you work on people strategies that would help develop holistically your faculty and staff so that they can thrive and thus help the institution thrive.